Technical Veterinary Learning Channel, honored by Prof.Ahmed Mamdouh El-Sherif, Professor of Epidemiology and Infectious Diseases, the ex-head of Department of Veterinary Medicine, the ex-Vice Dean of Faculty of Veterinary Medicine, Bani Suef University, Egypt, presents today. We are still in the series of epidemiology. Today, we will explain, clarify, discuss with detailed examples about a very important subject in epidemiological studies: epidemiology approach and methods, epidemiology study types. Epidemiology approach and methods. As with all scientific endeavors, the practice of epidemiology relies on a systematic approach. In very simple terms, we have to count, divides, and compares. Before counting cases, however, must decide what a case is. This is done by developing two case definition, then using this case definition to collect information about the diseased case, then performs a descriptive epidemiology by characterizing the cases collectively according to time, place, and population. To calculate the disease rate, we divide the number of cases by the size of the population. Finally, to determine whether this rate is greater than what one would normally expect, and if so, to identify factors contributing to this increases. We have to compare the rate from this population to the rate in an appropriate comparison group. Using analytic epidemiology techniques, and these actions will be described in more detail below. Epidemiology approach and methods. We are describe the counts, divides, and compares. Count cases or health events and describes them in terms of time, place, and animals or persons. Divides the number of cases by an appropriate denominator to calculate the rates. Compare these rates over time or for different groups of animals and peoples. A case definition. It is a set of standard criteria classifying whether an animal or man has a certain disease, syndrome, or other health status. Guarantee that every case is equivalent regardless of when or where it happened or who defined it. Before counting cases, the case definition have to be done. So, some case definition, particularly those used for the surveillance, have been developed and adopted as standards that ensure comparability. Use of an agreed upon standard case definition ensures that every case is equivalent, regardless of when or where it occurred, or who identified it, as all the team of epidemiology have to be practiced or identifying the case by the same character. Furthermore, number of cases or rate of disease identified in one time or place can be compared with the number or rate from another time or place. For examples, number of lumpy skin disease cases in Egypt at Bani Suef Governorate during 2012 and 2013 could be compared, as well as this number in area of Victoria Lake in Uganda could be compared at the same time. The number of lumpy skin disease in Gaza Strip at occupied Palestine at the time of 2012 and 2013 could be also compared. We can compare the number of SARS-CoV-2 infection at March in Wuhan zone in China with those cases at the same area in April 2020. So, when everyone uses the same standard case definition and a difference is observed, the difference is likely to be real rather than the result of variation in how cases are classified. Other case definitions, particularly those used in local outbreaks investigation, are often related to the local situation. For example, a case definition developed for an outbreak of foot and mouth disease illness might require laboratory confirmation where such laboratory services are available, but likely would not if such service were not readily available. So, case definition have to be practiced by all the epidemiology team to have the difference in numbers and of cases. Components of a case definition for surveillance and outbreak investigation. A case definition consists of clinical criteria and sometimes limitations on time, place, and person. The clinical criteria usually include confirmatory laboratory tests if available, or combinations of symptoms, subjective complaints, subjective symptoms seen by owners, signs, objective physical findings, and or other findings. Case definitions used during outbreak investigation are more likely to specify limit on time, place, and or animal or persons than those used for surveillance. Contrast the case definition used for surveillance of foot and mouth disease and for foot and mouth disease outbreak investigation. See in this box, where foot and mouth disease surveillance case definition, we described the clinical description. Infection caused by foot and mouth disease, and here we said 3 serotypes as we in Egypt, or put all the serotypes in your country, which may produce several clinical syndromes, such as fever of foot, vesicles and ulcers in mouth area, laminitis, and tick of hoof, and deaths of calves. Laboratory diagnosis, isolation of foot and mouth disease virus from mouth and blood of affected animals. Case classification, confirmed a clinically compatible case that is laboratory confirmed. Source, we here write the source of the case, veterinary medicine, decorate, and its laboratory in the area. And we here written the name of veterinary authorities. Case definition for infection condition surveillance. We write the definitions of the case, and then recommendation and reports. The year of recommendation and report, the number of other signs of the case, and report pages number. In foot and mouth disease outbreak investigation, we said about the case definition, clinically compatible illness with isolation of foot and mouth disease virus from mouth and the blood of affected animal. The place of outbreak in a farm of cattle production. And we write completely the address in details. With onset between, we here specified the time of occurrence of this investigation of the outbreak. A case definition for surveillance and outbreak investigation. The example here is for human medicine, Kawasaki syndrome. Case definition. The clinical description, it is a case of children with febrile illness of greater than or equal to 5 days duration, with at least 4 of the 5 following physical findings: bilateral conjunctival infection, oral changes, erythema of lips or oropharynx, stauroperi tongue or fissuring of the lips, peripheral extremity changes such as edema, erythema or generalized rash, cervical lymphadenopathy, at least one lymph node greater than equal to 1.5 cm in diameter. Laboratory criteria for diagnosis, none. Case classification, confirmed a case that meets the clinical case definition, comments if fever disappears after intravenous gamma globulin therapy is started, fever may be of less than 5 days duration, and the clinical case definition may still be met. So, Kawasaki syndrome here is a physical, medical case, not occurring as outbreak. So, the case definition is as we described before. Variations in case definitions. Case definitions may be also vary according to the purpose for classifying the occurrence of any disease. For examples, veterinary authorities or medical health authorities need to know as soon as possible if any animal or any person has symptoms of lumpy skin disease or foot and mouth disease, equine influenza, brucellosis, or tuberculous animal. Or in case of human, they want to know as soon as possible symptoms of plague or anthrax. So, these authorities can be planning what action to take for such rare but potentially severe communicable and pandemic diseases or epidemic diseases of animals, for which it is important to identify every possible case. The veterinary authorities or medical health authorities use what's called a sensitive case of definition. A sensitive case of definition is one of that is broad or loose in the hope of capturing most of all of the true cases. For example, the case definition for a sensitive case we can use if we suspect a case of blue tongue within a sheep flock. So, any animal show fever, bluish coloration of mouth area, increased rate of mortality within sheep flocks may be denoted to blue tongue. In case of human, suspected cases of German measles or rubella is any generalized rash illness of acute illness. This definition is quite broad and would include not only all cases of blue tongue or rubella, but also another cases with the clinical symptoms with blue tongue or with rubella can be taken within. So, sensitive case of definition is that it is includes the most of all the true cases. The disadvantage of this sometimes include other illness or other symptoms of diseases as well as. On the other hand, any epidemiological studying the causes of a disease outbreak usually want to certain that any animal or person included in this study really had the disease. The epidemiological study will prefer a specific or strict case definition. For instance, in an outbreak of foot and mouth disease in case of animals, or Salmonella agona infection in case of human, can be included. In this setting, the only disadvantage of a strict case definition are the requirement that every epidemiologist have to be defined that everyone with symptoms be tested and have laboratory diagnosis and an under determination of the total number of cases if some animals or peoples with salmonellosis or with E. coli infection or was mastitis or was rubella or with salmonellosis are not tested. One of the basic tasks in infectious disease studies and or public health studies is identifying and counting cases. These counts derived from case reports submitted by veterinarians, healthcare workers, and or human medical laboratories or veterinary animal laboratories to the both veterinarian department and human health department. This allows infectious disease and public health authorities to determine the extent and patterns of disease occurrence by time, place, and animals or persons. This may be also indicate clusters or outbreaks of the disease in the populations. Counts are also valuable for health planning. For examples, a health official might use counts numbers to plan how many infection control, isolation unit, or doses of vaccine may be needed. These counts also valuable for veterinary planning controls for the decided the number of population and the doses of vaccines needed, or how many plans could be applied in one country, such as Bank's plan for control of tuberculosis or single intradermal test for the whole country, and this decided by the economical position and budget of the veterinary authority in every country alone. Examples for cases counting during the last pandemic of SARS-CoV-2 in China at 10 March 2020, the total number is 80,924 confirmed cases, 20 new cases in the same day, with total 3,140 deaths, while in 30th of April 2020, the number be 84,373 confirmed cases with new confirmed cases in the same day. The total deaths increased to reach to 4,643 deaths, while in 8th of May today, the official of China said that the total number be 84,415 confirmed cases with 6 new cases for the same day, with the deaths at the same level. This counts give an idea about the distribution of the disease and said to local authorities and to health authorities if the planning is succeeded or failed. However, simple counts don't provide all the information for veterinary or health department needs. For some purposes, the counts must be put into context based on the population in which they arose. Rates are here measures that relate the number of cases during a certain period of time, usually per year, to the size of the population in which they occur. For example, during the year of 2006 in Egypt, lumpy skin disease caused deaths for 2,800,000 animals. This equals about 40% of the total of animal population in Egypt. In United States, during the year of 2002, persons have AIDS is about 42,745. Rates are particularly useful for comparing the frequency of disease in different localities whose population differ in size. Rates are useful for comparing disease occurrence during different periods of time. For example, health authorities in Egypt announced that total number of SARS-CoV-2 in Egypt up to 8th of May 2020 is about 7,500 persons. This means that every 1 million in Egypt has only 75 infected persons. Another example that chickenpox cases in human in United States during 1991 is about 19.5 per 100,000 persons. Rate of disease among different subgroups can be compared to identify those at increased risk of the disease. This related to the occupational disease segment. The most prominent example we hear every day during pandemic of COVID-19 that healthcare providers all over the world have 10 to 13% of their total number becoming infected. So they so-called high risk segment or high risk groups have to be further assessed and targeted for special intervention. High risk groups can be also studied to identify risk factors that cause them to have an increased risk of the disease, while some risk factors such as age and family history for breast cancer or for occurrence of mastitis may be modifiable, where highly producing cattle in dairy farms with certain breed definition showing high mastitis rate of occurrence due to they are highly producers if they put in unhygienic conditions such as Jersey cattle. Epidemiology study types. Epidemiology have a range of study designs from observational, experimental, and theoretical. Generally, observational categories are descriptive and analytical. Experimental, a term often equated with clinical or community trials of treatment and or other interventions. Theoretical or hypothesized. Observational studies, nature is allowed to take its course as we observe from the sidelines. Conversely, in experimental studies, we control of all the factors entering a certain case study. Epidemiology studies are aimed, where possible, at revealing unbiased relationships between exposures such as entrance of tuberculosis with newly purchased cow to free farm, alcohol or smoking addiction, or linkage between chemical exposure in polluted cities to increased rate of mortality and morbidity due to lung or respiratory affections in animals and humans. The identification of causal relationship between these exposures and outcomes is an important aspect of epidemiology. In modern epidemiology, we use informatics as a tool. Observational studies have two components, descriptive and analytical. Descriptive observations pertain to the who, what, and where, as well as when the disease or health-related state occur. However, analytical observations deal more with the how of a disease or health-related events. Experimental epidemiology contains three case types: randomized controlled trials, often used for new medicine and veterinary medicine or drug testing; field trials, conducted on those at a high risk of contracting a disease, segmented or occupational disease, or animal with high risk factors due to presence in certain communities, as well as community trials, research on certain populations. Comparison between descriptive and analytical epidemiology. Descriptive epidemiology defines the frequency, distribution of diseases and other health-related events, while analytical epidemiology analyzes the different determinants of diseases and other health problems. In descriptive epidemiology, we looking for how many populations were affected. And in the same time, analytical epidemiology, how was the population affected? Descriptive epidemiology, asking about when was the population affected, while analytical epidemiology, searching for why was this population affected. Descriptive epidemiology, asking about where was the population affected and who was affected in this population. Descriptive epidemiology describes the distribution of disease of interest, possible cause factors in terms of animals or human populations, locality, seasonal time which affect in a population. Descriptive epidemiology usually describe the what, who, where, when, and why, how of a situation, whether it be a space shuttle launch, or a house fire, or farm affection. We strive in characterization of epidemiological event, whether it is endemic of foot and mouth disease or pandemic of SARS-CoV-2, or even a local increase in all trainee vehicle crashes. However, epidemiology tends to use synonym for the 5 W's. What? Health issue of concern. Who? Animal or person. Where? The place. When? The time. Why and how? Causes, risk factors, modes of transmission. Descriptive epidemiology covers the time, the place, the agent, animal or persons. Compiling and analyzing data by time, place, and agent is desirable for several reasons. First, by looking the data carefully, epidemiology becomes very familiar with every data, as we can see what the data can or cannot reveal based on the variables available, its limitation. For example, the number of records with missing information for each important variable, as what is missing in increasing number of cattle affected with foot and mouth disease even with vaccination. And it is contract. For example, all cases range in age from 2 months to 6 years plus 17 years old, in increasing the rate of their deaths in Africa. Second, the epidemiology learn the extent and pattern of public health problems or veterinarian diseases to be investigated, in which months, such as babesiosis during the summer months, or foot and mouth disease during winter, or flu during winter, which neighboring farms or neighboring cities, and which group of animals or peoples are at the most and least cases. Epidemiology creates a detailed description of the health of populations, either for animal or human, that can be easily communicated with tables, graphs, and maps. We all see from the month of January until today maps, tables, and graphs of COVID-19 distribution all over the world, with number of new cases, total cases, mortalities. Fourth, the epidemiology can identify places or groups within the population itself that have high rates of disease. We said before the segment population. This information in turn provides important clue to causes of certain diseases. That's why newly born calves showing diarrhea or showing respiratory form of red nose because of absence of vaccination. And this clue can be turned into testable, measurable. Time. Occurrence of disease changes over the time. Some of these changes occur regularly, while others are unpredictable. Two diseases may be occur during the same season each year, including foot and mouth disease and respiratory manifestations, or in human, flu in winter and West Nile virus infection in August and September. In contrast, diseases such as hepatitis B and salmonellosis can occur in any time. Lumpy skin disease now is endemic and can occur in any time. In animals, 4 diseases that occur seasonally, such as babesiosis, such as Venezuelan equine encephalitis, such as West Nile virus equine encephalitis, veterinarians and health officials can anticipate their occurrence and design control and prevention measures for them, like vaccination or massive treatment of population which come contact with the causes. For diseases that occur sporadically, epidemiology can conduct studies to identify the causes and the mode of spreading and then develop appropriate targeted action to control and prevent further occurrence of the disease, such as increasing of bloat in cattle farms that eat forage, so we can provide in the second time during cultivation some carminative plants to prevent this bloat. This is also epidemiology. In either situation, displaying the pattern of the disease. Occurrence by time is critical for monitoring disease occurrence in the population and for assessing whether the veterinarian or public health intervention made in correct way or in wrong way, like massive vaccination of foot and mouth disease every 4 months now occur in Egypt for protection against occurrence of the disease. It is a successful method. In the past, massive vaccination occurred only 2 times per year, and it is a wrong control design. So when we correct this design by 3 vaccination every year, the number of diseased animal become near 0. Time data are usually displayed with 2-dimensional graph, and we in studying them for contract the time of outbreak caused by contaminated or pasteurized milk or others. This is in case of salmonellosis or E. coli infection for entering them in new community for human consumption, or reporting a new case of tuberculosis in new community or new population of animals due to introduction of newly infected animal. Sometimes time is plotted and depending on the disease. The time scale may be as broad as years or decade, or as brief as days or even hours of the day. Avian flu studied and taken time for long years to control. For some conditions, many chronic diseases, for example, such as tuberculosis, jaundice disease, epidemiology tend to be interested in long-term patterns in the number of cases or the rate. For other conditions, such as plotting outbreaks, the relevant time here is 4 days or hours. Some of the common types of time-related graphs are further described during the following slides. Seasonality. Disease occurrence can be graphed by week or month over the course of a year or more to show its seasonal pattern. If some diseases that reported in this sheep collection with flushing procedures of feeds that occur during the months before feast of sacrificing at all Islamic countries due to overfeeding and flushing of these sheep struck disease, one of the clostridial infection, reported more than others. In human, influenza disease or flu disease occur and reporting all over the world during the winter season. So, knowing and characterization of seasonal distribution may be suggest the control and the causative agent possible of these diseases. Descriptive epidemiology of COVID-19 in Egypt from the date of 31 of December 2019 up to 10 of April. In December 31, 2019, China Republic reports severe cases of unidentified pneumonia. In 7th of January, viral infection identified as a novel coronavirus. At the end of January, WHO declares a public health emergency of international concern. In Egypt, reporting the first case of coronavirus in Cairo at 14th of February. At 3rd of March, Egyptian Minister of Health traveled to China. At 8th of March, first COVID-19 fatality recorded in Egypt. At 13th of March, 33 cases recorded on Luxor Aswan cruise ship. 14th of March, announcement of Egyptian 100 billion initial COVID-19 prevention plan and suspension of educational facilities. At 16th of March, CPE cuts of interest rate by 300 billion. At 19th of March, suspension of aviation. At 21 of March, mosques, churches closure and CPE as community additional support to tourism and industry. At 16 of March, 495 COVID-19 cases confirmed. Overnight, nationwide embargo reported. At the 10th of April, total detected COVID-19 cases reached to 1,794 with 135 deaths. It is a descriptive epidemiology for COVID-19 in Egypt between the time of December 31 and April of 2020. Descriptive epidemiology, also asking about the place, describing the occurrence of the disease by place, provides insight into the geographical extent of the problem and its geographical variation. Characterization by place refers not only to place of residence, but to any geographical location relevant to disease occurrence. Such locations include place of diagnosis or report, the site of worker, school district, hospital unit, veterinary medical provider, recent travel destination. The unit may be as large as quantities or countries or as small as a street, farm, or even wing in hospital or farm inside a governorate or operating room or veterinary laboratory in certain street. Sometimes place refer not to a specific location at all but to a place category such as urban or rural or Bedouin, domestic or foreign, as intestinal or non-intestinal. The example here is what World Health Organization given as a chart. Information given to travel from Ebola and to Ebola affected countries, where what everybody need to know. This during the Ebola time. This chart describes the signs of Ebola and what the person have to be taken to come out and come a distance from taking Ebola by application of hygienic personnel. Descriptive epidemiology dealing with places, and it is a very important way during studying the occurrence of disease in a place. Analytical epidemiology work through analysis of different observations by using of diagnostic procedures and statistical procedures. The key features of analytic epidemiology is a comparison group. By analysis of the disaster epidemic of lambskin disease that reported during 2006 in Egypt, by analysis of demographic factors such as age, sex, and cattle breeds, constitutional factors such as the immune status of the cattle at that period, circumstances such as entrance of new animals from infected areas, revealed that all cattle with all ages, all sexes, all breeds are infected, and the immune status of the animal is low, as doses of vaccinations that come out from Abbasiyya Institute is lower than the number of the whole population of cattle in Egypt. About the circumstances, there is new entrance of cattle from Ethiopia at that year. So, identifying factors associated with any disease help veterinarian authorities or health officials for prevention and control activities. It also guides additional research into and about the causes of the diseases. Thus, analytical epidemiology is concerned with the search for causes and effects, or why and how. Analytical epidemiology used to quantify the association between exposures and outcome and to test the theories about causal relationship. Also, epidemiology by itself can never prove that a particular exposure caused a particular outcome. Often, however, epidemiology provides sufficient evidence to take appropriate control and prevention measures. Epidemiological studies fall into two: diagnostic procedures and statistical procedures, and combine between this for analysis of occurrence of any disease. A good example for analytical epidemiology is that study done in Netherlands at 2018 about tuberculosis in human beings at that area. This analytical epidemiology studies showing the number of infected persons between the years of 2014 and 2018. About 469 showing pulmonary tuberculosis and 337 showing extrapulmonary tuberculosis. 21 of these cases are active by finding and screening and contact investigation, while 79 of these cases are found by symptoms appearance. When analysis of the persons, they are found that 77 of foreign persons coming from another countries are infected, as Ethiopia, Morocco, India, Somalia. Also, when they are tested the people infected by tuberculosis for immune-compromised disease or HIV infection, they found that the highest rate are found at 2015 by about 74%, and lower one is about 2014 by 61. How many are notifiable persons? The most notified noted at 2017 by about 1,832 persons are infected. So the analysis of this chart showing that the highest number of tuberculosis in Netherlands showed at the year of 2016. The most symptomatic tuberculosis is with pulmonary type, and the most detected persons not diagnostic but by symptoms. Also, HIV infected persons showing high rate of infection by tuberculosis, and 77% of foreigners are infected by tuberculosis. This chart helps in control and prevention programs for tuberculosis in Netherlands. World Health Organization elaborate this map for pandemic H1N1 at 2009 about laboratory confirmed cases and number of deaths as reported at the date of 30 of August 2009. We found that United States and Mexico showing more than 100 deaths. This also noted in South of America, in Australia, India, and the southeast of Asia. In Europe, while in Iran, Saudi Arabia, Egypt, and South of Africa, the deaths between 1 to 10. This is analytical map for the distribution of H1N1 in the world during the dates elaborated. Analytical epidemiology of presence of SARS-CoV-2 throughout the world by elaborating of COVID-19 meter at the 29th of April 2020, showing that total cases all over the world at that time is about 3,020,000 and total deaths are 22 and 8,000. So these numbers are distributed all over the world, as in United States about infection of 1 million, in Russia 99,000, in UK 65,000, in China 82,000. This analytical about the number of cases reported and confirmed in laboratory give us an idea about the distribution of COVID-19 throughout the world. Experimental epidemiology. In experimental studies of epidemiology, we determined through a controlled process the exposure of each animal or person in a clinical trial or in a population trial, and then tracks them over a time to detect the effect of the exposure. For example, in a clinical trial of any new vaccine, we may randomly assign some of the veterinarians or practitioners to receive new vaccine while others receive placebo shots. We then track all vaccinated animals or human. We get the disease in some animals or human. So this will show is intended to prevent and compare the two groups to see whether the vaccine group has a lower rate of disease or not. So at the end of follow-up period, we describe how the lowest incidence of a disease is reported or not. So experimental epidemiology means that observe and analysis the data from controlled group we choose and we collect of animals or men. This group which can select and we alter the different factors that affect on them and use one factor for testing. Experimental studies beginning at 1920, and this means at that time study of epidemics among colonies of experimental animals such as rats, mice, and rabbits. Aims of experimental studies is by submitting scientific evidence of cost factor which may allow modification or control of any disease. as well as providing a way to measure effectiveness and efficiency of veterinarian or health services for preventing, controlling, and treating diseases, which improving community and population health. If we compare between advantage and disadvantage of experimental studies, we will show that advantage of experimental studies afford proving of causation with lower alignment and using of historical domains with mortality issue are cleared and visibility we can saw everything. But the disadvantage of experimental studies that unsuitable usage of historic control drive to a severe fault and it take long time and expensive in its cost. Experimental epidemiology used in animal studies for confirmation the theory of causation. It is viral or bacterial or fungal or prion and so on. Also, it used to study the pathogenic happening, how it causes the disease. Also, testing the effectiveness of preventive and the treatment measures. Animal studies by experimental way fill up neutralistic history of the disease. Also, it playing a serious function in human seeking for information about himself. It will be take this infection or not. Also, it have contribution to all medicine section. Experimental epidemiology in human studies leads to investigate theory of causation, also evaluate effectiveness of drugs, and fill up neutralistic theory of disease, how it's caused, playing serious function in human vaccine and evaluation. Types of experimental studies: clinical and therapeutic trials, field preventive trials, community and population intervention trial, risk factor trials, cessation of experiments, health service evaluation trials. 8 steps for design the experimental trial. By writing the protocol design, reference population, either animal or human, we will make our experiment, then take population sample and assumption by make 2 groups, experimental one and control group, then randomization and manipulation intervention, following up the experiment, and then the last step is estimation of result to show what we are studied. A good examples here about the experimental design is the dogma of randomized control trial, or RCTS. We give an example with one of the vaccine come in the site of all world. It is COVID-19 vaccine. So, application of COVID-19 on trial on patient after ethically inform them about what's going on. Then we divide these patients into 2 groups, vaccinated group and control group. Vaccinated group takes vaccine, control group have placebo. Then compare the results between vaccinated group results and those come from control group which taken placebo. To reach to acceptable result, this will take time about 1.5 years up to 2 years. All human studies have to be done ethically. Theoretical epidemiology, or mathematical modeling of any infectious disease by simulating the natural pattern of disease occurrence. This can project how infectious disease progress to show the likely outcome of an epidemic and help information veterinarian authorities or public health authorities about intervention. Models are basic assumption or collected statistics along with mathematics to find parameters for various infectious disease and how to use them as the parameter for calculate the effect of different intervention like mass vaccination program, like occurrence of pandemics. Comparison between theoretical or mathematical modeling epidemiology in its advantages and disadvantages. We will note that the advantages of this epidemiology, it makes progress and improve practice by directed acyclic graph which can model many different kinds of information including infectious diseases. Make it clear how difficult social epidemiology is and what is need randomized control trial or instrumental variables or a change in exposure. It also clear definition of necessary variables in analysis. It helped to solve hormone replacement controversy about myocardial infarctions. While the disadvantages, it gives uncertain results, but rather relies on mathematical theories to sign the epidemiology of any disease. Uncertain results, but all are hypothetical. As COVID-19 or SARS-CoV-2 pandemic is questionable all over the world, so many theoretical epidemiology or mathematical modeling are tried to solve its problem and to show how it will be longed for and how it will be infect the people and how many peoples will be infected. The example of that, the medium-term COVID-19 forecast 19 forecasting epidemic forecasting.org more than RDT_CID equal. Researchers from Oxford of Humanity Institute have created country-specific prediction of the current and future spread of COVID-19 coronavirus by the basic reproduction number, denoted by R0 model, by measure of how transferable a disease is, by mean that how this virus transmitted to whom and how many. This model works as the following. The impact on the selected region is stimulated using an epidemiological model based on global, real-world data on human population and travel patterns, displayed as an epidemic curve. The mitigation strength is its choice. This model emphasizes that real outcome depends on human actions. Even given some mitigation level, the outcome is still uncertain and depends on virus seasonality, viral response to different weather conditions, mitigation decisions made by other countries, technological progress in testing, contact tracing, and vaccines. The results of this model are used as an input to the publicly available version of the epidemic modeling software GLEAM. To see to the results of this program, results are displayed as a pack of trajectories representing the uncertainty inherent in this model and the difference in trajectory caused by the response of us as a society. This model expects that at the second day of May 2020, USA will have around 2 million people infected, but the official number is about 1,132,000, was lower than about 1 million than the Oxford model estimated. This model expected that Russia at the same day will have 84,000 infected people, but officially it will be higher. It's about 124,000 people already infected. This model expected that China will have at the second day of May 2020 4 million persons infected, but officially in China the authorities announced about 82,875 persons already infected. In UK, this model expected that around 1 million persons infected, but officially health provider in England said that about 177,000 people are infected. This model expected that Germany will have 234,000 people infected, but the official number is around 164,000 people are infected. So there are differences between the model and the official number in this case. This describes that this is an estimation and hypothetical for estimation how the infectious disease will be. The difference between the number of this model and the official number indicate uncertainty of the model numbers because of a lot of reasons, such as number of real tested people. The results of this model are used as an input to the publicly available version of the epidemic modeling software GLEAM and decisions made by other countries. Epidemiology series will be continued by TVL channel, so please subscribe this channel to have the rest.